Yes, ma'am. It's live now.
Okay. Are you sure we are live? I don't think.
Yes, ma'am. You have to, yeah, we are live.
Hello, everyone. Good evening.
Ma'am, we won't get any response because it's YouTube. So we'll just have to do the speaking and the questions will be from the portal.
Yeah.
Hello, everyone, and welcome to our course on herbal product development with all our instructors. Feel free to put in your queries on the chat box, and we are happy to help you all with that. Thank you.
Yeah, good evening, everyone. And I hope you are enjoying the course. We have she's talking.
It's late.
We have just introduced you to the basic of herbal drug technology. And I hope you have gone through all the videos and you are enjoying learning with us. We are all here and would be very happy and pleased to answer all your queries, if any. If there are doubts or if you would like to know more about what we have shared during the video and in the notes. You can type your questions in the chat and we will take them one by one.
Also, feel free to put in your feedback and any additional learnings that you want from our end. We'll be happy to support as well.
Yeah, there were two questions. We can start with this. I don't know if they have joined, but we got two queries on the portal. The first one is how to take or decide concentration of an extract in order to prepare any formulation. How do you decide on the quantity? You will have to do little literature search of the herb that you have chosen for formulation. How do you choose this herb? You choose the herb once you know for which disease you are targeting the formulation. So once you have chosen your herb, go to the literature and find out how much quantity of the herb is going to show minimum therapeutic efficacy. So between that and the IC50 value. So you see properly how much is going to be toxic and how much is going to show a therapeutic activity. Between that, you choose your drug for formulation. And if you're going to test the bioactivity for the first time, take the minimum dose and take a dose little higher than that. But you'll have to look for the literature and find out in animal studies how much of it is showing toxicity. And there's a formula to convert the animal dose to human dose. That is the first query which we got. The second one is when we are discussing about asavas and aristas, which are liquid oral formulations used in Ayurveda, we use dhatki pushpa. Now these dhatki pushpa, they have natural colonies of yeast which is present in them, which helps the substrate to generate alcohol. So the query was how much to use. Generally, up to 5 grams per 100 ml can be used. And this is documented in Ayurveda texts. It is documented in official textbooks if you want to refer to formulas of how aristas and asavas are made. So these were two queries which we got online. Then the third query was, will you please suggest any research area in which Ayurvedic formulation integrated with novel drug delivery can be used? novel drug delivery system can be integrated with any traditional system of medicine. You name a herb and we can apply a novel drug delivery technology to convert the traditional form into modern day dosage form. So there are no limitations of which drug can be converted. Here, when you do this, we just have to keep in mind some traditional system of extraction procedures and formulation procedures. Suppose in tradition it is mentioned that it is formulated as a grita, then we have to use some lipid base to dispense that active ingredient or the herb. But you can almost convert anything that is available in the traditional system using the novel drug delivery system. Are there any more learners? Okay, there is another question. He is a wellness practitioner and he has traditional knowledge. He's asking if he can manufacture herbal drugs. For manufacturing herbal drugs, you need the premises which is approved. So, you can suggest that, but wherever you are going to manufacture, that manufacturing unit should have a license to manufacture. That is very important. So you have to fill a form for inspection and make sure that your manufacturing area is approved for manufacturing. How can we attempt the tricky question during the final examination? Just study, get your basics clear. I think then you'll be able to answer. Go through the notes which we have given you additionally along with the PPTs. And if you've not understood the PPT once, listen to the PPT again and get some basics clear. I think then you can. And try and understand the question. I think the question is not very tricky, but if you understand the question, then the answer is very easy. Pattern of the question paper is MCQ. The final examination will be only MCQs for 100 marks. There is another query which says advice for beginners. So if there are beginners and learners who are totally new to herbal drug technology, I think the initial videos you focus on where we have discussed what is a herb, what is present in a herb, how do we separate these constituents, how the constituents are responsible for therapeutic activity, and what are these different kinds of secondary metabolites which are present in a herb. Once you understand that, then you understand different kinds of dosage form. I think these two basics will help you understand the entire course very well. Mandar sir and Galvina ma'am, would you like to add to this? I think these basics will make them easy to understand.
Yes, and in addition to that, there are definite reference books also, which we generally provide in the reference section. So, in addition to our sessions, those reference books also will help you to gain in-depth knowledge because considering the number of hours that we've been allocated, we are little restrictive in terms of the information that we are disseminating. But if you require additional informations, again, you can put in through the chats. We'll give you more in-depth references or book references, which will help us, you gain a little depth of knowledge in those subjects as well. So if it interests you, even topic wise, you can raise a query. We'll give you a topic wise reference list. Thank you.
Yeah, thank you, Galvina. And apart from that, what I will suggest that because of the lot of content already available on YouTube, So you can go through the other references, other videos. There are very good videos about the herbal drug industry layouts and manufacturing units. So you can go through with them, and you can then from there you can gather the information, and then that we can discuss onto this such open forum. So that will also give you much clarity about the herbal industry and how it works in the actual premises. So that will definitely help you even during the examination also. Much of our notes are derived from our lectures, but apart from that, whatever ma'am told about the references that we can share with you, and those also will be helpful for you for your exam point of view as well.
I see another query here where I don't know, Shilpa, I can see what we need to do if you have to export herbal drugs to another country. I think wait for a couple of more weeks. Mandar sir is going to cover in depth about the regulatory requirements for herbal exports. So
Correct.
just a couple of weeks more and you will get to know about the regulatory field.
Correct, correct. It is this today's forum is too early for you to have the information about
Understand?
the
Yeah.
regulations and all, because step by step we will go ahead. With that time, you can understand what are the different types of regulation required and are there in the this program, where you can understand in detail about those regulations, and then you can also think about if you want to go for any particular export, what are the basic requirements in your facility or in your premises or in your manufacturing unit.
But by the end of the course, you will definitely come to know what are the regulatory guidelines and how do they differ country-wise. Can we have a quick feedback of how you are enjoying the course so far? People who have joined online, can you all give us a quick feedback of how you have been enjoying the course? It's a sincere request. Please share your feedback. Another query which asks us for a toothpaste, is it mandatory to show efficacy on all the points mentioned in the notes? Yes. For a product to be accepted globally and in the market better, it is always good to launch the product with all kind of QC required. So it is up to you, make sure that there is no product recall. So once you carry out all the test, then, however, this is a little less regulated field. So with traditional or literature knowledge, even if you put the product in the market and if the product has some problems, then you will be responsible for it. Thank you very much for the feedback. Thank you very much for the feedback. Pattern of the question paper, I think somebody is asking, mini is this thing. Pattern of the question paper, we answered 100 MCQs will be there. It is only MCQs. Yes, any more queries? Thank you. So we have with us Rujuta Gandhi and Mr. Pavan Kumar Singh, who are associated with the course. And if you're enjoying the notes, they are here with us to help you all and to help us with the notes.
Yeah, notes and the even other literature what we were sharing, they are through them they are getting scanned and it is getting updated every week. So even you need any extra notes or any extra literature about the topic, you please put in your feedback. If it possible, you will put it in the drive.
Tricky question. We have told you, I mean, at your own pace, try to listen to the videos and try to go through the notes. I don't think exam will be very difficult. 100 marks exam. I think whoever is mini, don't worry about the exam. You just enjoy the course and get information. Exam is just an outcome. So don't worry so much about the exam. You try to get benefits as much as you can from the course. Answer my query again.
Uh, Galvina ma'am,
Yeah.
are we, they maybe I want to they're interested into the what is the
Pattern.
pattern means, that is a description
So
of
the pattern you will get it on the NPTEL
correct.
course where you are logging in itself. So there is a 100 MCQs end questions, and this 100 MCQs at the end are converted into 75% marks, and then you have what is called as internal assessment. So daily, weekly rather, you give answers to certain questions, right? So all the marks of it are taken into account, and then we pick out best 8 assignments. So best 8 assignments you will be graded or picked up, and those best 8 assignment marks will be converted into 25%. So 75% NSEM and 25% internal assessment, and you've been given, at least 50% to, in your internal assessment to qualify for the end exam. So in your internal assessment, if your score is less than 50%, you are not eligible for the end exam. If you become eligible, in that you have to attempt 100 MCQs at a designated center that is be coming in your hall ticket, and post that 100 MCQs, they are converted into 75% marks and you will be graded based on that. The total of this 75 plus 25 is again converted out of 100, just added, and in that also you to go to plus 50%. So that is how the split it is, and we might have a mixture of MCQs as well as multiple select questions, but it is not subjective answer that we are looking for. It will be a tick option based. So does that clarify the question pattern?
Thank you ma'am for update.
So I'm just sorry, a little correction. I checked in the portal. Yeah, it is not 50%. It is, if you convert it into 75, 30 out of 75 is passing for your end sem, and 10 out of 25 is passing for your mid end, or what you call it as the continuous. So I think they've revised the guidelines. So just check. So 10 out of 25 and 30 out of 75. So just a little correction here. So total out of 100, you have to have 40. It's not 50, it is 40.
Any more queries? Are there any more queries? So can we end the session and they can keep posting their queries through the portal?
So requesting both of you, those who join in, if you have any further queries, just feel free to drop in. Yeah. And then, we'll just wait for another quick 2-3 minutes. If there are any no further queries, we are good to close the session. But that's not the end of our communication. We'll communicate via portal as ma'am suggested. That would be, like a offline communication. But for online communication, you can raise it here itself within the next few minutes.
And you can keep your queries, fight with you, and then in the next session, in the next month, we can also have.
So all these guidelines, just to give you a quick recap, are all there on the same course page that you got it. Functional food. Swati ma'am, you want to take functional food?
I think I have discussed when the week where we are discussing nutraceuticals, I have classified different kind of nutraceuticals. So functional food is one class of nutraceuticals. But are you into functional food? Do you want to know more? So please write to us, then we can give you details. What exactly do you want to know about functional foods? Dietary supplements, functional foods, these are different kind of nutraceuticals. So it's a very vast field. So what exactly do you want to know about functional food? Food taken with a purpose is functional food. So when you're eating food for some health benefit, where you know the function of that food, suppose you're eating garlic, you're eating onion to reduce your cholesterol, that becomes a functional food. You're eating cabbage or any cruciferous vegetable to fight some kind of infection, then you're taking food with a purpose, with some scientific knowing. Fortified food is something where extra it is added. Like suppose you have a juice, you have pudding, or you have some other kind of food where externally some vitamins, minerals are added to it. Functional food is natural. You are eating that food in its natural form, but for a purpose. Does that answer your query? You have mineral water where you have added excess vitamins, excess minerals. So you have fortified that food. Suppose I have some kind of extract where externally I have added to enrich that extract. Then it becomes fortified food. You get real juice in the market which is fortified with vitamins. So that becomes fortified food. And food, a natural food which you are consuming, knowing its scientific or therapeutic value, becomes a functional food. Okay. It is discussed in week 3, but I'm glad to answer your confusion. Anything else? Any more queries? Yes? So we'll wait for 5 more minutes and 4:30 then we can close the session. So yes, fortified food goes through scrutiny because you've added external elements to it. So you have to prove that it is not toxic, it is safe. It does go through scrutiny because you're changing the natural form of food.
What I want to add here is a fortified food is actually beyond is our course curriculum, because we are here to discuss about the drugs and the nutraceutical and dietary supplement also we can discuss. But fortified food, as ma'am said, it's much of a particular ingredient in a extra quantity or extra strength to make it advanced. So definitely it is a food purpose used and not less about the any therapeutical use or any therapeutic purpose. So vitamins or minerals which are for the growth of the human body can be used here as a fortified food.
Calcium, which is
Correct.
added to a food product, iron, excess of iron added.
So more of nutritional the components.
Should we close the session? Galvina ma'am?
Yeah, I think Shilpa and Minnie, if you have no further questions, we'd like to close the session by 4:30. So we just wait another 2 minutes and then we'll be closing it. Yeah. Yeah, ma'am, there's one more question from Shilpa.
Are scientific literature enough to prove efficacy? No. Your product, whatever you have made from literature, you'll get an idea, but you have to do a testing for your product. There are drugs or herbs listed in FSSI. Those drugs are considered to be safe, but you are mixing them, making a polyherbal formulation and putting it in the market in a different form. So, suppose you're just buying turmeric and eating, then it's okay. But then you are claiming a nutraceutical value to it, a therapeutic value to it. You're mixing more than one herb. It has to go through a testing. See, like I told you, you can put it in the market. If there is a problem, then it comes back to you. This is little loosely regulated market. People put formulations as long as there is no problem, but you cannot, if you want a good market, you want to export it, it comes with a line of quality control tests. Scientific literature will give you an idea of what kind of QC you need to do with respect to different constituents present. That is your first support document to proceed with. Because the geographical source will vary. Today, if I say ashwagandha in this thing, because it is reported in this literature, from where have you collected your ashwagandha? There are a lot of things which make a difference when you are dealing with herbs. But yes, if a drug is listed in FSSI, you are allowed to put it in the market as a formulation. Shilpa, do you run a manufacturing unit, or do you have a lot of products? Okay, Galvina ma'am, I think it's 4:30. Okay.
So yeah, thank you all for the good interaction. From here, we'll just close the session. But yes, this is not the end of it. So Shilpa, yeah, definitely we'll continue our interaction offline. But thank you again, once again, for your questions. Take care and thank you, everyone.
Yeah, thank you. Thanks a lot.
Thank you, everybody. Have a nice evening and see you all soon in the next interactive session. And We are here to answer your queries through the portal. Please feel free to post any doubts that you have. Thank you.
What are you taking on?
YouTube also
Okay. Okay.
Is it offline now?
Yeah, we are offline.